and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Scientists find out how fasting may help protect against inflammation. Cambridge scientists may have discovered a new way in which fasting helps reduce inflammation, a potentially damaging side effect of the body's immune system that underlies a number of chronic diseases. In research published in Cell Reports, the team describes how fasting raises levels of chemical in the blood known as arachidonic acid, which inhibits inflammation. The researchers say it may also help explain some of the beneficial side effects of drugs such as aspirin. Inflammation is our body's natural response to injury or infection, but this process can be triggered by other mechanisms, including by the so-called inflammasome, which acts like an alarm within a body cell triggering inflammation to help protect a body when it senses damage. But the inflammasome can trigger inflammation in unintentional ways. One of its functions is to destroy unwanted cells, which can result in the release of cells content into the body, where they trigger inflammation.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
High hospitalization rates despite low risk, almost 2/3 of pulmonary embolism patients admitted. An analysis of more than 1.6 million emergency department visits for acute pulmonary embolism found that nearly 2/3 of ED visits still resulted in hospitalizations for low-risk patients. This trend remained stable between 2012 and 2020, despite research indicating the safety of outpatient management. The analysis is published in Annals of Internal Medicine. PE is a leading cause of cardiovascular mortality, and its clinical management among patients with more severe presentations often require inpatient hospitalization for intravenous anticoagulation or other advanced therapies. However, in recent years, it has become increasingly clear that outpatient management for some low-risk patients with acute PE is safe and feasible approach. Researchers from Harvard Medical School and Beth Israel Diakonis Medical Center studied data from the National Hospital Ambulatory Medicine Care Survey for 1,635,300 patient visits to evaluate whether the proportion of discharges from EDs for acute PE changed between 2012 and 2020, and which baseline characteristics were associated with ED discharge. DNA particles that mimic viruses hold promise as vaccines. Using a virus-like delivery particles made from DNA, researchers from MIT and the Ragon Institute of MGH, MIT and Harvard have created a vaccine that can induce a strong antibody response against SARS-CoV-2. The vaccine, which has been tested in mice, consists of a DNA scaffold that carries many copies of viral antigen. This type of vaccine, known as the particulate vaccine, mimics the structure of the virus. Most previous work on particulate vaccine has relied on protein scaffolds, but the proteins used in these vaccines tend to generate an unnecessary immune response that can distract the immune system from the target. In the mouse study, the researchers found that the DNA scaffold does not induce an immune response, allowing the immune system to focus its antibody response on the target antigen. DNA, we found in this work, does not elicit antibodies that may distract away from the protein of interest, says Mark Baith, an MIT professor of biological engineering. What you can imagine is that your B cells and immune system are being fully trained by the target antigen, and that's what you want, for your immune system to be laser focused on the antigen of interest. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.